Hello, my name is Debbie Reynolds. They call me the Data Diva. Today I want to talk about health apps and data privacy. Health apps have been very helpful to people in terms of being able to track their health information with their doctors, whether that be in things like appointments, diagnosis, medications. But over the years, there have been commercial companies that have put out health apps to do things like you want to track you being able to count your steps or how long you run or at the gym, or possibly even you wanting to enter things like your blood pressure or some other factor like cholesterol, for example. However, in the present time, in terms of things like our current global pandemic with coronavirus, people are creating apps, or companies are creating apps to track individuals in things like quarantine, things like tracking certain symptoms, and things like that. People are concerned about these particular apps for a couple of reasons. One, if this app is not really associated with a doctor or a medical professional, whether it's giving advice that may not be correct or maybe collecting data about an individual, you may not be sure about how they're handling your privacy. On the far end of the spectrum now, there are apps that are in production currently and are in use currently in certain countries. I believe Israel and Hong Kong are certain places where they say this is being used, which is an app that can basically quarantine you digitally. So you would, for example, you would download the app, you would be given a SIM card to put on your phone, you would give a wrist bracelet to sort of track your movements, and then when you got to the place where you're going to be quarantined, whether it's your home or a hotel, you have to sort of mark the perimeter of where you'd be staying digitally with this app, and it will track you for 14 days. Currently, the way the app is meant to be used, or the way they want it to be used, or they say it will be used, is that after 14 days, the person can remove the SIM card or delete the app. The concern with civil libertarians around the world and privacy advocates is what is being done with that data. Is it being sold to other people after the quarantine is over? Is this information being kept or stored or shared in some way? People are concerned that having this data about an individual may lead to some type of discrimination or xenophobia in some ways, but it still remains to be seen how this will play out. As we all know, in cases of crisis that are of public health, governments have expanded rights and responsibilities about what they do with data and how they interact with people and their data about health, because it is a public health emergency. So once things settle down and we're not in the same mode of crisis as we tend to be right now, people are wondering about what will happen to this data. Will it be sold? Will it be shared? Will it be kept? So it remains to be seen how that happens. We're going to really be able to check and look very closely at health apps, because we know that they definitely have some upsides, but we also have to think about the downsides or possible harms to make sure that the data is being used in the best way possible. Thank you.